Hey everyone, it's your name from Life After 50S. We all know that paying attention to our bodies is key, especially as we age. And you know what's a surprisingly good indicator of what's going on inside? You guessed it, our pee. Ever wondered what the color of your urine says about your health? We're diving deep into the fascinating world of pee. Don't worry, it's not as gross as it sounds. We'll explore the 7 different colors of urine and what they could indicate about your well-being. We'll cover everything from crystal clear to shades that might make you do a double take. Remember, this video is for informational purposes only and shouldn't be taken as medical advice. If you're ever concerned about your health, always reach out to your doctor. Now let's get into it. All right, let's start with the most desirable color, clear urine. Now, you might think, clear? That's got to be a good sign, right? And you're not wrong. Clear urine usually means you're well hydrated, which is fantastic. It means your body is getting enough fluids to flush out toxins and waste products effectively. But here's the catch. There can be too much of a good thing. Just like not drinking enough water can be a problem, overhydration is also something to watch out for. If you're constantly chugging water and your pee is consistently clear, you could be diluting essential salts in your body, like electrolytes. Electrolytes are crucial for regulating muscle function, nerve function, and hydration levels. So, if you're feeling weak, dizzy, or experiencing muscle cramps, even though you're drinking tons of water, overhydration could be the culprit. Now, I know this might sound counterintuitive, drinking too much water, but trust me, it's possible. The key is to listen to your body and find that sweet spot, drinking enough to stay hydrated without going overboard. A good rule of thumb is to let your thirst be your guide. If you're thirsty, drink up. But if you're not, don't force yourself to chug water just because you think you need to. And remember, everyone's hydration needs are different. Factors like your activity level, climate, and overall health can all play a role. So, it's always a good idea to chat with your doctor to determine what's best for you. Bottom line, clear urine is generally a good sign, but if it's constant and you're experiencing any unusual symptoms, it's worth checking in with your doctor. Next up, we have pale yellow urine. Think of this as the Goldilocks of pee color. Not too clear, not too dark, but just right. Pale yellow is a sign of optimal hydration and a healthy balance of water and waste in your body. When your urine is this color, it means your kidneys are doing their job effectively, filtering out waste products and excess fluids while retaining the essential nutrients your body needs. It's like a well-oiled machine, humming along smoothly. Now, the shade of yellow can vary slightly throughout the day, and that's perfectly normal. You might notice your first pee in the morning is a bit darker yellow, especially if you haven't had anything to drink overnight. But as you hydrate throughout the day, your urine should lighten up to that pale yellow hue. And that's what we're aiming for. If you're consistently seeing pale yellow when you pee, give yourself a pat on the back. It's a sign that you're taking good care of yourself and staying adequately hydrated. Keep up the good work. Now, if your urine starts to resemble apple juice more than lemonade, it's time to pay attention. Dark yellow urine often indicates dehydration. It's your body's way of waving a flag and saying, "Hey, I need more fluids over here." When you're dehydrated, your body conserves water by concentrating your urine, which gives it that darker color. Think of it like this: your kidneys are trying to hold on to every precious drop of water they can. Now, mild dehydration is usually nothing to panic about. We've all been there, a busy day, forgetting to drink enough water, and boom, dark yellow pee. But the key is to address it quickly by rehydrating. Grab your water bottle, sip on some electrolyte-rich drinks, and your pee should return to its normal color within a few bathroom breaks. However, if you're consistently seeing dark yellow urine, even after increasing your fluid intake, it's essential to consult with your doctor. It could be a sign of an underlying medical condition that needs attention. Chapter 4. Let's move on to amber urine. This color is even more concentrated than dark yellow and can be a sign of severe dehydration. It's your body sounding the alarm bells, urging you to replenish those fluids as soon as possible. If your urine looks like amber, it's crucial to prioritize rehydration immediately. Start sipping on water or electrolyte-rich beverages and, if possible, rest in a cool environment. Now, amber urine can also indicate other issues beyond dehydration. It could be a sign of excess waste products in your body, like bilirubin. Bilirubin is a yellow pigment produced during the breakdown of red blood cells. High levels of bilirubin in the urine can indicate liver problems or bile duct obstruction. So, if you're noticing amber urine, especially if it's accompanied by other symptoms like fatigue, abdominal pain, or yellowing of the skin or eyes, it's crucial to seek medical advice promptly. Chapter 5. Brown urine can definitely be alarming, but it's not always a reason to hit the panic button. Sometimes it's as simple as what you've been eating. Certain foods like fava beans, rhubarb, or aloe vera can temporarily turn your urine brown. Similarly, some medications like anti-malarial drugs and muscle relaxants can also have this effect. So, if you've recently indulged in any of these foods or started a new medication, that could explain the brownish hue. However, brown urine can also indicate more serious issues, particularly with your liver or kidneys. If you haven't had any dietary or medication changes and your urine remains brown, it's essential to contact your doctor. They can run some tests to determine the underlying cause and recommend the appropriate treatment if needed. Remember, it's always better to err on the side of caution when it comes to your health. Chapter 6. Let's talk about red or pink urine. Now, this is one color that tends to send people straight into panic mode, and for a good reason. Red or pink urine can be alarming and may be a sign of blood in your urine, medically known as hematuria. Hematuria itself isn't a disease, but it's a symptom of another condition that needs to be addressed. It can be caused by various factors, ranging from urinary tract infections and kidney stones to more serious conditions like bladder or kidney cancer. Now, before you jump to conclusions, it's important to note that not all cases of red or pink urine are caused by blood. Certain foods like beets, berries, and rhubarb can temporarily tint your pee red or pink. Similarly, some medications like antibiotics and laxatives can have the same effect. So, if you've recently enjoyed a beet salad or started a new medication, that could explain the change in urine color. However, if you haven't had any dietary or medication changes and you notice red or pink urine, especially if it's accompanied by pain during urination, back pain, or fever, it's crucial to consult with your doctor immediately. Chapter 7. Last but not least, we have blue or green urine, the rarest of them all. While seeing these colors in the toilet bowl might make you feel like you've entered a sci-fi movie, they're usually not a cause for major concern. In most cases, blue or green urine is caused by certain medications or food dyes. For example, some medications used to treat urinary tract infections or stomach ulcers can turn your urine blue or green. Similarly, brightly colored foods and drinks, like blue raspberry popsicles or green sports drinks, contain dyes that can temporarily tint your pee. So if you've recently had any of these, that's likely the culprit. However, in rare cases, blue or green urine can indicate a rare genetic condition called familial hypercalcemia. This condition causes high levels of calcium in the blood, which can lead to blue or green urine. So if you haven't had any dietary or medication changes and your urine remains blue or green, it's best to consult with your doctor to rule out any underlying medical conditions. So there you have it, the 7 colors of urine and what they could mean for your health. Remember, your pee can provide valuable insights into what's going on inside your body. Paying attention to its color can help you stay on top of your hydration levels and potentially catch any underlying health issues early on. But remember, while urine color can give you some insights into your health, it's always best to consult with a healthcare professional for any concerns. Self-diagnosing based on your pee color alone can be misleading and potentially harmful. So stay hydrated, stay informed, and don't hesitate to reach out to your doctor if you have any worries about your health. Until next time, stay healthy.